let's deal with mental health because that's one of these overlooked issues that no one even thinks about unless they happen to have someone in their immediate or extended family who has a mental health issue. And I fall into that category. I mean, I'm one of these people who's gone through life, and I've never been confronted or needed to confront the mental health world or deal with it in any way. But a few years ago, let's go back about 8 years now, some college friends and I, one of them in particular is a mental health a professional, and he wanted to conduct some research, and a couple of friends and I we volunteered to help him out. We kind of learned an awful lot about America's mental health field, and of course the interrelated issues of drug addiction and homelessness, and then from the point of view of politics, we realized, holy cow, this is a linchpin that is holding together a whole bunch of problems across society that can be solved if we as a community deal with mental health in the proper way. So that's just kind of the generalized backdrop of how I came to this problem. But let's look at a little bit of history. If we go back in time to essentially John F. Kennedy and before, there were mental hospitals all across the country. And people who had mental health problems, in some ways, could be easily committed to a mental health institution by the family members and the loved ones. And if they didn't do it, or they couldn't do it, or they weren't around, then the courts could very easily commit someone to a mental health institution. So that was perceived as being a problem because it gave non-doctors pretty much, it gave other people a lot of power over someone who suffered from a mental disability. And so the society of the day viewed that as being an egregious affront to the rights of people who suffered mental disabilities. So the very last document that President Kennedy signed the day before he was assassinated essentially enacted a law that made it very, very difficult, or much more difficult, for the family and the loved ones and the courts to commit someone to a mental health facility. That little fact is lost to history. I mean, unless you research what I just said, nobody would have any reason at all to think about this in 2022. But that wasn't, in fact, what happened. Now, so you can say that mental health, as we knew it, made a big change just before Kennedy was assassinated. And then we fast forward to the 80s, and Ronald Reagan did the other half of the deed, so to speak. And essentially, he defunded mental health hospitals across the country. And after the Reagan administration, the country lost 90% of its mental health hospitals. They were closed down. So it got to the point where now it's very, very difficult to get someone with a mental disability committed to psychiatric facilities care or psychiatrist care. Now here is the conundrum. So in mental health, it's like a curve. And on one side of the curve, you have people who are high functioning, they can take care of themselves, no problem, and their mental health disability is very low. And then on the other side of the scale, you have people that have a very high mental health disability, and they have a very low ability to take care of themselves. And then in the middle, we have this curve where both of those variables are changing. The degree of mental disability and the degree or ability for one to take care of themselves. So what that means is, underneath the current system, all of those folks are essentially out in the street. I mean, it's only when you get into the folks that are criminally dangerous to others, or they're very likely to commit suicide. And even then, it's very hard to keep people committed. So if we look around the country, we see 125,000 homeless people in Los Angeles alone, okay? The vast majority of those 125,000 people suffer mental disability and drug addiction. And one of the things that we discovered, going back to the very beginning of the conversation with my friend who was researching this relationship between drug addiction, mental disability, and how you actually rehabilitate this crowd, we discover that they go hand in hand. If you have a mental disability, you're very likely to also suffer from drug addiction. And why is that? Well, the answer is very simple. The folks with a serious mental disability are medicating themselves. They're using the powerful drugs on the street, like heroin and cocaine, to self-medicate. Those things turn into addiction, uncontrollable addictions, and it creates massive problems in terms of crime, homelessness, housing, just a huge, it just goes on. It's a huge draw on tax dollars, a huge draw on community resources, a tremendous amount of safety and unpleasant activities around the society. So by doing nothing, we have the situation that we have today.